Magnesium citrate also plays a quiet but essential role in gene expression and epigenetic regulation. Every cell in the body contains DNA, and the process of reading and transcribing this genetic code into proteins is governed by a range of enzymes and cofactors, many of which require magnesium. DNA polymerases, RNA polymerases, and repair enzymes all depend on magnesium as a stabilizer of nucleic acid structures and a charge balancing agent during replication. This means magnesium directly supports cellular regeneration and maintenance, and it indirectly ensures the proper functioning of growth, healing, and immune modulation. In people with the MTHFR mutation, whose methylation efficiency may already be compromised, supporting accurate DNA synthesis and repair through optimal magnesium intake is especially vital. Within the reproductive system, magnesium contributes to hormonal balance and fertility. For both men and women, reproductive hormones are synthesized and broken down by liver enzymes that rely on magnesium. For women, magnesium influences ovulation, reduces premenstrual symptoms, and may help alleviate menstrual pain by relaxing uterine muscles. In men, magnesium contributes to testosterone production and sperm motility. Magnesium also helps balance the ratio of estrogen to progesterone by aiding liver detoxification of excess estrogen. Since individuals with MTHFR polymorphisms are often poor methylators and slow detoxifiers, hormone buildup can occur more readily. This makes magnesium citrate a strategic supplement to relieve hormone-related symptoms and support endocrine detox. In immune health, magnesium acts as a modulator, not a suppressant or stimulant, but a regulator that helps the body avoid overreaction or immune fatigue. It influences T-cell function, antibody production, and the control of inflammatory cytokines like IL-6 and TNF-alpha. Chronic magnesium deficiency is associated with increased susceptibility to infections, heightened allergic response, and even autoimmune dysregulation. Since the MTHFR mutation often leads to elevated homocysteine and oxidative stress, which in turn inflame the immune system, having magnesium present to buffer these immune fluctuations is especially protective. It helps reduce the baseline inflammatory state that many with methylation defects endure. In the kidneys, magnesium is filtered and reabsorbed constantly, maintaining electrolyte balance. It works alongside sodium, potassium, and calcium to regulate hydration, blood pressure, and pH. Kidney function is highly dependent on magnesium for protection against nephropathy, crystal formation, and inflammation. The kidneys help convert vitamin D to its active form, calcitriol, and this step too is magnesium dependent. Individuals with MTHFR variants sometimes have issues with calcium balance and calcification, especially if their B vitamin intake is poorly managed. Magnesium helps prevent soft tissue calcification and kidney stones by keeping calcium in solution and promoting its proper utilization. Magnesium also interacts with sulfur-containing compounds, which is relevant to detoxification and connective tissue health. Sulfation is a detox pathway that helps neutralize hormones, drugs, and environmental toxins by attaching sulfate groups to them. This pathway relies on adequate magnesium, cysteine, and molybdenum. Since people with MTHFR mutations can have altered transsulfuration and glutathione synthesis, they may also be vulnerable to impaired sulfation. This makes magnesium an indirect but essential cofactor in managing chemical sensitivities, histamine intolerance, and the breakdown of synthetic compounds like medications and preservatives. Additionally, magnesium supports skin health and collagen production. It influences hydration, inflammation, and wound healing. Collagen synthesis, the backbone of skin, ligaments, and cartilage, is magnesium dependent. People with MTHFR issues may have thinner connective tissue barriers or be prone to inflammation-related skin conditions such as eczema, acne, or premature aging. By supporting tissue integrity and hydration, magnesium citrate promotes a healthier skin barrier and more resilient connective tissue system. Magnesium is also deeply connected to sleep quality. It helps regulate melatonin production and binds to GABA receptors in the brain, both of which promote relaxation and deeper stages of sleep. Those with MTHFR mutations frequently report insomnia or disrupted circadian rhythms due to impaired neurotransmitter clearance and heightened stress response. Magnesium helps correct these imbalances by promoting parasympathetic nervous system activity and reducing nighttime cortisol spikes. People who supplement with magnesium citrate often notice improved sleep onset, fewer awakenings, and deeper, more restorative sleep cycles. The pancreas, too, benefits from magnesium. It regulates insulin secretion and sensitivity, helping cells respond to glucose in the bloodstream. Low magnesium is correlated with insulin resistance and increased risk of type 2 diabetes. Since insulin is not just a blood sugar hormone, but also a growth and repair signal, optimal magnesium is necessary for the entire anabolic repair cycle of tissues. In people with MTHFR mutations, insulin resistance may develop more readily due to chronic inflammation and oxidative stress, two processes that magnesium directly mitigates. Magnesium also impacts respiratory function. It relaxes bronchial smooth muscle and has been shown to be beneficial in asthma and chronic obstructive pulmonary disease, COPD. Its role in reducing inflammation and improving oxygen utilization is often overlooked. For individuals who already face oxidative stress from impaired methylation, supporting respiratory resilience with magnesium citrate can reduce shortness of breath, wheezing, or exercise-induced asthma. Magnesium also modulates neurotransmitters such as serotonin, dopamine, and acetylcholine, all essential to mood, memory, and focus. Magnesium-dependent enzymes help convert amino acids into neurotransmitters and facilitate the reuptake and recycling of these chemicals. People with MTHFR issues frequently report symptoms of anxiety, depression, irritability, or ADHD. By restoring magnesium levels, they may experience improved emotional balance, cognitive clarity, and executive function. It's not just about calming the nervous system. It's about fueling the chemical production and clearance systems that maintain emotional regulation. The adrenal glands, which sit atop the kidneys and produce stress hormones, are also sensitive to magnesium levels. When under chronic stress, the body burns through magnesium quickly. This depletion worsens the stress response, creates sleep disruption, and raises systemic inflammation. Those with MTHFR polymorphisms already have compromised methylation of stress hormones, which leads to a more prolonged and erratic stress response. Magnesium citrate can dampen the HPA axis overactivation and protect against adrenal burnout. In terms of cellular hydration, magnesium regulates aquaporin channels and balances intracellular water retention. This affects everything from mitochondrial function to lymphatic drainage and detox efficiency. Inadequate hydration at the cellular level can lead to fatigue, sluggish metabolism, and tissue congestion. Magnesium helps optimize osmotic gradients and ensures that water and electrolytes are properly distributed across membranes. The synergy between magnesium and B vitamins is crucial. While magnesium doesn't directly methylate compounds, it enables the enzymes that do. For example, B2, riboflavin, B6, pyridoxine, B9, folate, and B12, cobalamin, all require magnesium-dependent reactions to be properly utilized. A deficiency in magnesium can render B vitamin supplementation less effective, and in some cases exacerbate symptoms by creating unmetabolized B vitamin intermediates. This is particularly relevant for individuals supplementing with methylfolate due to MTHFR mutations. If magnesium is not concurrently addressed, methylfolate can cause overstimulation, anxiety, or migraines. Another rarely discussed role of magnesium is its involvement in circadian gene regulation. Several clock genes, which control the body's 24-hour biological rhythms, are regulated by magnesium-dependent signaling. People with sleep-wake cycle disturbances, common in MTHFR dysfunction, often see improvement in circadian regulation once magnesium levels are restored. In the liver, magnesium aids in phase 1 and phase 2 detox pathways. In phase 1, magnesium stabilizes cytochrome P450 enzymes that begin the breakdown of toxins. In phase 2, magnesium assists in conjugation reactions, sulfation, glucuronidation, acetylation, that transform toxic compounds into water-soluble forms for elimination. Since MTHFR mutations affect the folate cycle and impair liver detox efficiency, magnesium helps compensate by strengthening parallel detox routes. In sum, magnesium citrate doesn't just perform isolated tasks. It weaves into every system: digestive, neurological, cardiovascular, endocrine, skeletal, muscular, immune, and genetic. For people with MTHFR mutations, magnesium serves not only as a supportive mineral, but as a critical compensatory ally in mitigating the biochemical consequences of impaired methylation. It is the quiet stabilizer, the background catalyst, the mineral that keeps the engine of human physiology running smoothly.